Howdy folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Science says most shoulder pain eliminated without surgery, can be eliminated, I suppose, without surgery, with 4 simple steps at home.
Right. This is
pretty amazing. This is an amazing study.
So we're going to get
it's true.
Well, it is true, man. It's as a matter of fact, I've been working with it with not only myself with patients, and we've been getting a lot of comments on this technique from our viewers commenting on how
say that it worked for
right, yeah, and it's simple. So shall we get to it, Bob?
Pay attention, yeah. Well, first, if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, Brad's going to do his job here. Take another minute and go over to Facebook and like us. It's Bob and Brad, because we're giving out positive vibes to all of you who like us.
Right.
Feel it? Feel it, Brad?
Oh, yeah. And their shoulders are getting better already.
Yeah. Just by us talking about it.
All right.
So you want...
I got it, Bob.
All right, since I remembered. All right. So
we're talking about this study. You know, I'm not even 100% certain on how to pronounce it, the Kauai study.
I think that's an island in Hawaii, isn't it?
Well, I'm not sure. It may be in New Zealand or in Australia, but whatever. It was done.
We really know our geography, don't we?
It was done in. I should have looked it up. It's done in 2012. There was 92 patients.
Let me just stop 1 second. Can you see this okay, Liz? It's not glaring? Okay,
yeah, we checked it out before.
Oh, you did? All right.
Oh, yeah, I'm on the ball.
All right.
So 92 patients, that's a pretty good number.
Yes, it is. A good sample size.
Right. 2 of them did drop out for other reasons, but so they had a good, everyone.
So they're down to 90.
Right, they're down to, no, they had 94, they went down to 92.
Oh, gotcha.
90% of them were successful with.
No, 90 were successful, which makes 98%.
There you go. Right.
Yeah. So that's a lot.
It is.
That's almost everybody.
If you could get 98% success in the clinic, you're doing.
Yeah, you're
rocking the boat.
Guru.
Right. So I'm looking at this. I'm like, how does this happen? How can you get that kind of shoulder recovery? And look at this: 70% or 70 of them were impingement, which is a really common problem.
It is.
16 of them were rotator cuff tear, confirmed by MRI. 4 of them were frozen shoulder, and 2 of them were severe arthritis.
All right.
I mean, so
we were just saying that's kind of the breakdown we'll see in the clinic.
Oh, right.
Yeah.
It's pretty common. I think most therapists would agree with that. You get 98% success with that, you're doing great.
Right.
And not only that, there was a follow-up years afterwards, so it wasn't just a temporary fix. So
excellent.
Let's get on with how to do it.
You probably want this up here yet, though, right?
Sure. Yeah, because my memory obviously is not so good.
Okay.
Now the viewers know that we use a cheat card.
Yeah. Oh, yeah.
By the way, this study was done primarily led by Dr. John Kirsch, which is his book, which is a really good book. All therapists, I think, should read it. Physicians and lay people.
We'll put a link below. It's a little bit geared towards the science. It's not necessarily for the layperson, but you'll get the idea from it.
There's a lot of anatomy and some body mechanics that you may not understand if you're the layperson, but the exercise routine is definitely based on so you can do it at home. As a matter of fact, he talks about if you got a tree limb that's the right height, you can use that for one of the primary exercises. Okay, so let's talk just a little bit about why this works, and we're going to use Sam for that.
Super Sam.
Super Sam. It just happens that 95% of shoulder problems are from impingement.
Yeah.
From the supraspinatus, which happens to be this red highlighted tendon, and then this acromion bone here, things get impinged upon there, which 70 of these were impingement, and then this ligament, the coracoacromial ligament, gets tight oftentimes, and it doesn't allow enough room in here, which causes the impingement, along with you can also get arthritic problems, bone spurs, etc.
Yeah, it leads to almost all the shoulder problems.
Right.
I mean, that impingement. Right. And to a tear. I mean,
right, exactly. So we need, the biggest thing is to open this up.
Yeah, we got to expand it.
And what we have oftentimes surgeons do is they go in there surgically and they open the gap.
Yeah, they'll grind away at the bone.
Right, they will go, and that's exactly what they do. But if you don't want to go into surgery, this is very simple to work with, and as you know, it's got good success rates. So,
and it doesn't cost you anything except trying to set up a bar. I mean, it's easy to try.
Yeah.
So, what?
Not the bar that you go have a drink at.
Why do you always think that right away?
I live in Wisconsin, Bob. Okay, here we go. So, the first thing you're going to do is simple. Like Bob says, you get a bar. And actually in the book, they show you how to set up some bars at home with simple pipes.
Oh, really?
Yeah.
So through the rafters or what?
Yeah, they show that method. They show how to buy 1-inch pipe and just set up a real simple, that anybody can go to the hardware store and set something up. So that's all in the book too. So we got a bar here, and what you're going to do is, I like it so you can stand and get it at a height you don't have to reach way up, but you can do it either way and get a stool. And we're going to do partial hanging. So I'm just going to hang and let part of my weight go through my feet and part of it through my hands, and let pain be your guide. And if your shoulders are sore, which they probably will be initially, it's going to be painful, and you're only going to hang for 5 to 10 seconds, and then you're going to give it a break.
You're building up your tolerances. The other thing is, he had recommended, if I remember right, actually wearing gloves. Because a lot of people, it's going to start to, get blisters on their hands.
And you'll see, and he also has some wrist straps to even, so you don't even have to, if you have a bad grip.
Oh, sure.
There's ways to get around that too if you have arthritic hands. So that's in the book as well. And then again, you're going to repeat this a number of times, up to 5 to 10 times, depending on how your shoulders tolerate it. When you start, it might only be a few times, and as you go on for a few days, you can go build it up to 30 seconds up to a minute. I personally go 30 seconds at the very most. And I've had,
that's a long time.
Right, it is. Yeah. So again, you have to work with this and see how your body responds.
Now, do you go to the point where you are actually hanging, or do you always have your feet on the ground a little bit?
I have my feet on the ground just a little bit, so I have some control. But I will go full. As a matter of fact, just recently, I swim a lot. I got a mile swim to do in a couple weeks. And my shoulder over the years acts up, and it started to act up. And so I started my hanging just a couple of weeks ago, and within 3 or 4 days of hanging, I only did it once a day, the success is incredible.
But you jumped right on it too. You didn't let it get real severe.
Right, so, I didn't wait till it got severe.
Some of the more severe problems are going to take, they're not going to happen in a week.
Right.
They're not going to improve.
Yep, it comes upon. And then he says, follow up right away. As soon as you get done hanging, get a light weight. You'll probably start out with 1 pound, maybe 2, and palm down, and he says flexion, which is straight in front of you, like this. You may start out with only 10 reps, 15 reps, depending on how it feels. If it hurts hard, you don't go so high. You go in a near pain-free range, okay? Then out to the side, same thing. Eventually build up to 30 to 45 reps, but they should be relatively pain-free when you get there. And then extension, all of them with your palm down.
Okay? Again, which is strange to us, but
right.
We're following his program.
Right, because he's got great studies, and I'm going with him. He's an orthopedic surgeon.
Yeah,
I mean, he's done many surgeries.
Yeah, he's been in there. He knows what things look like.
He understands the mechanics of the shoulder. I will do extensions like this, just so I can. They suggest bent over in the book, but I'm saying
it's nice to get support.
Put your hand on it to
a lot easier on the
back.
Yep, a lot easier on the back.
Okay, so that's it. It's
a real simple program. I mean, the tough part about it is building up the tolerance and being able to hang for. Because what does he recommend as the maximum? What did you say, a minute?
Yeah, I believe it's up to a minute. Initially started out 10 to 30 seconds. Like I say, I really don't go that long. I go, my hands start to get tired, and I just let go, and I'm having great success. You need to learn your body, and there's no specific amount of time for everyone.
Right.
So,
all right, sounds good.
There you go. Fix your shoulders up well, and Bob, I don't know. I'm thinking.
Remember, we can fix just about anything except for a broken heart.
Right. Well, we're getting closer. I mean, the heart and the shoulder, you get heart.
They're close.
Referred pain goes to the shoulder sometimes.
Right.
This could be a connection.
Yeah, I think so. Thanks.